Ose Ogun. I represent Eastern Southeast, Eastern Northeast, and I am from Edo State. Need to evaluate the effect of withdrawal of HIV funding by international donors. The House notes that the World Health Organization, WHO, classed Nigeria as having the second highest HIV epidemic in the world after South Africa. The House also notes that since 2005, the number of annual AIDS-related deaths has multiplied, indicative of the fact that only 51% of those living with HIV in Nigeria have access to the antiretroviral treatment, ART. The House further notes that the country's health sector is partly dependent on international donors for the procurement of antiretroviral drugs, as the federal government contributes 25% of funding for HIV management. The House is aware that in consideration of the rating of Nigeria as the biggest economy in Africa, international donors have withdrawn funding as regards HIV response, which is reserved for poorer countries. The House is concerned that as a country with large number of persons living with HIV who require treatment, Nigeria is unable to produce any of the prescribed World Health Organization drugs required for the management of HIV. The House is cognizant of the need to increase HIV response, especially with regard to funding. The House resolves to 1, urge the federal government to urgently commence plans for effective funding of HIV. 2, mandate the Committee on HIV, AIDS, Tuberculosis, and Malaria Control to liaise with relevant agencies in the health sector to work out modalities on the effective management of HIV response. Mr. Speaker, my highly esteemed colleagues, I so move. My highly esteemed colleagues, once again, I'm Sergius Ogun. I represent Eastern Southeast, Eastern Northeast. I'm from Edo State. Mr. Speaker, I would like us to avert our minds to when the virus HIV was detected in humans in the 80s. It became one of the most deadly diseases that ever affected human beings. But with the help of discoveries, people can now live with HIV virus and to a large extent live a fulfilled life. Even in present day, we have couples that are both HIV positive and they will marry and have children that are not carrying the virus because of discoveries. Now, with the antiretroviral drugs, the HIV sufferers are able to manage this disease and live a normal life. But like I said in my motion, the international donors have moved out, that have stopped supporting Nigeria. One, because they said we are the largest economy in Africa. But Mr. Speaker, that's not all. Global Fund were largely the largest donor to NACA. That's the National Agency for Control of AIDS. And part of the reason they moved out, they stopped giving funds to NACA, was because NACA could not justify money given to them, the monies they were giving to them. So they had to cut off the funding, because there was an audit where they could not account for almost $3.7 million. So this motion basically is to urge this House to get the government to vote more funds, since the international donors have stopped funding this program. Because most of the people, the sufferers of HIV/AIDS, are really those that need to be helped, the vulnerable. And if you cut off funding for this, we're going to have so many people die without help. So I want to urge every member today to look at this motion closely, and for the benefit of this vulnerable group, urge the government to vote funds so that we can produce antiretroviral drugs in the country to support this group of people. Thank you, Mr. Speaker. Thank you, my colleagues.
Anyone who wants to speak?